sort of slightly anxious about this talk. I'm sort of relieved that there are people who know a lot more about pregnancy than me participating in it. Also, I usually actually rehearse my talks just before I'm going to do them, which is why I'm on my computer. I've never rehearsed a talk singing Yellow Submarine before. So the format of this session, and the reason for having it really, is that pregnancy is a very big issue for women with LAM. LAM is a disease almost exclusively of women, and the most common time to find out that you have LAM is in your early 30s, and that often corresponds with the time that nowadays people are thinking of starting a family. And it's something that, as a LAM doctor, you spend a lot of time talking to patients with. And like many things in LAM, there are really no right or wrong answers for this. There are small bits of evidence, and it's an area where we have to sort of make judgments about what's the best thing to do at the time, thinking about the person's health, about their desire to have a family, and their future happiness, and perhaps even how their child's going to be brought up. And it's a pretty difficult area, and there are a lot of issues. So really this session is, I'm merely going to introduce it and just say what's known about pregnancy and LAM, and then three people who've been at the sharp end, really. Kate Burrows, Sarah Maloney, via the wonders of a DVD, and Sarah Sharples are going to talk about their experiences and decisions about whether to get pregnant or not, and using adoption as an alternative. So, I mean, the issue here really is that there have been a lot of case reports in the medical literature over the years saying that pregnancies are dangerous for women with LAM. So I'm just going to summarize a little bit of that data, really focusing on the only study that there's been that we did actually quite a while ago now. Here we're going to hear from our three patients, and perhaps have a little discussion about it towards the end. So, yeah, quite a lot of case reports have described LAM either coming to medical attention during pregnancy, so if someone gets pregnant, they have complications and LAM is diagnosed while they're pregnant, or people with LAM becoming pregnant and their disease getting worse. And we know that one of the main problems that women with LAM have when they're pregnant is pneumothorax. Now, pneumothorax is a common problem for women with LAM anyway. About 70% of women with LAM will have a pneumothorax. During pregnancy, the risk for a woman with LAM is probably 10 times as great. If you look at how many pneumothoraxes occur outside of pregnancy and during pregnancy, on a sort of the risk on any given day is about 10 times more when you're pregnant. So it's a significant issue for patients. About half of women with LAM have angiomyolipomas, these benign renal tumours, usually sitting in the kidneys, that usually don't cause any trouble at all. And there are case reports of these growing quite rapidly when people are pregnant, and sometimes bleeding, requiring urgent treatment during pregnancy. And as a consequence of all this, particularly in years gone by, many doctors would just see somebody with LAM. It wouldn't matter how bad their lung disease was or how good their lung disease was, and they'd just tell them that they weren't to have children. And that really isn't an appropriate situation in all cases. As I say, we did a study a few years ago now. The lead person was Marcia Cohen, who's a Canadian professor of epidemiology, and she also has LAM and does LAM research. And this was a survey of several hundred women with LAM. It's retrospective. There are a few problems with it, with this study design, but it's probably the best evidence that we have. And the first thing that Marcia did was she asked the women in the survey, and there were over 100 of them who had LAM but hadn't been pregnant, why they didn't have children. And what you'll see, about half of the patients in total either weren't ready to have children at that particular time or didn't want to have children at all. But a sizable number of them, actually about half or more, were either afraid to have children because they had LAM, or they've been told by their doctor usually not to get pregnant. So this is a significant problem for people. The next thing that we did was we looked at what happened to women with LAM who became pregnant. And we looked at the obstetric side, so what happened during pregnancy. And we looked at the respiratory side, what were the respiratory complications during pregnancy and after. So there are over 200 patients in this group. There's a greater number of pregnancies, because some of them have been pregnant more often. And there are three groups of women here. There are the people, and these were the majority of people, who'd already had children and then developed LAM after they'd finished their family. And that's this diagnosis after pregnancy group. Then there were people who didn't know they had LAM, became pregnant, had complications, and were found to have LAM during their pregnancies. And then there was this other group of people who had LAM, decided they wanted to have children and became pregnant knowing they had LAM. And the sort of highlight points from this, I think, is that the women who either were found to have LAM when they were pregnant, or who had a baby after the diagnosis was made, had a much higher incidence of premature birth. I mean, often, particularly in the diagnosed during pregnancy, that was emergency cesarean sections when people had pneumothorax or other problems, and there were high rates of that, and often these pregnancy experiences ended in some form of elective intervention for the baby to be delivered early. Although it's not on this slide, the good news about this was the outcome for the baby was always good. None of the babies died as a consequence of these complications. So pregnancies for the women with LAM often ended rather abruptly and with medical intervention, but the overall outcome for mother and child from the obstetric point of view was usually good. In terms of the respiratory outcome, there was a much higher incidence of pneumothorax in the patients who had became pregnant after the diagnosis was made, although a significant minority of people who didn't know they had LAM, had children, and it was diagnosed much later, actually had pneumothorax during their pregnancy, so they obviously really did have LAM when they were pregnant the first time. It was just a long time before. So a high incidence then of medical intervention during pregnancy, good outcome for the babies, high incidence of pneumothorax mostly. The next question, which is slightly more difficult to quantify, and there's often been reports about in the medical literature in the past, is whether having a pregnancy, and with all the female hormones that are around at that time, somehow activates the disease or accelerates it, so the outcome for the lung function is worse afterwards. So what this slide shows are diagnosis before or during pregnancy, so those two groups sort of lumped together. Diagnosis after pregnancy, so the people who had their families first, then got diagnosed with LAM, and LAM patients who'd never been pregnant. So what you see is that the people who in this survey apparently had children when they had active LAM, so whether they either presented with it or had it after diagnosis made, appeared to have slightly lower lung function. So their FEV1% predicted was a little lower than this group and the patients who'd never had children. And their gas transfer was similarly lower. Now, that's a slightly worrying statistic at first glance, I guess. But what complicates all this, of course, and is discussed in the paper but doesn't come out in this table, is that a lot of these people who presented early would have been younger patients and may have had more aggressive disease anyway. And you can't really say whether it's due to the pregnancy or whether it's due to the fact that they just had difficult LAM, and so it was presenting earlier before they'd had children. So I think the jury's still out about whether it affects lung function, but that's possibly the case. So what I'm going to do now is let Kate Burrows speak, who's very kindly agreed to share her pregnancy experiences with us. And I think Kate's pregnancy highlights a lot of the issues that we sort of think about when we're thinking about women with LAM becoming pregnant. So I'll hand over to Kate.
Thank you. Afternoon, everybody. So those of you that have known me a while know that I've been off the radar screen for a couple of years. I've missed 2 LAM action days like today because I've had a little boy who's now 2.5. And I went into that pregnancy knowing I had LAM. So hopefully I've got some useful things to share. Before I start, a bit of background on my LAM. I was diagnosed in 2010. And the only symptom I really had was I had a stubborn right side pneumothorax. So I had a surgical pleurodesis, which I hoped would fix it and keep it up. And it did until about halfway through my pregnancy. But I have 80% lung function before and after birth. I go running. I did before I had Harry and stuff. So I don't have a very bad disease at the moment, touch wood. So our decision to have a child, Simon asked me to talk about that first. We couldn't really decide whether to have children or not mainly because of LAM, just because we didn't know if we really wanted to have kids, because we have quite a nice life. And so we were really in 2 minds about the whole thing before LAM came into the equation. But obviously LAM did come into it, and that was where it was great to talk to Simon and Professor Wells at the Brompton, because I was really worried, would it exacerbate my LAM and make it permanently worse? So would it reduce my lung function? But I think the advice, in summary, the advice from both Simon and Professor Wells were, if you want to have children, go for it. Which didn't really help us with our issue of, do we really want to have children? So we put our engineering and scientific backgrounds to one side and basically just left it to fate. And about a month later, I was pregnant, but I didn't know it yet. So that was that, decision made. So, my LAM pregnancy journey, I guess, starts here in Nottingham. I'd come up to take part in the doxycycline trial back in, it was April 2011, it was just before Easter weekend. And I knew that you had to have a CT scan in order to go on the trial, and you couldn't be pregnant to go on the trial. So because I arrived a bit early, I went out and bought a pregnancy test, did all the bleep tests in the morning first, did a pregnancy test, knew it would be negative, looked at it, and it said pregnant 5 weeks plus. And I'd had like half a bottle of wine the night before. I was like, oh my God. So I was completely in shock. And do you remember Will Chang, who was around at the time? He was running my pre-trial tests. And I just gave him the stick and said, what does it say? And he said, oh, it says you won't be doing the doxycycline trial. And I was like, oh my God. So luckily, I had an appointment with Simon later that afternoon while I was up in Nottingham. So we were able to have a really focused discussion about, oh my God, do I go ahead? Oh my God, it's actually happened, and all of that kind of stuff, which was really useful. And I guess the overall message I got from Simon was, it's unlikely to exacerbate your LAM on a permanent basis, but you may have problems while you're pregnant. And how right he was. There we go. So the shocks didn't stop there. At my 12-week scan in June, I remember the words of the sonographer, which were, there's baby, and there's baby 2. And I went, oh God, there are no twins in mine or Alex's family. There's absolutely no connection having twins. So suddenly I was there with twins and picked up the phone to Simon again, which was now becoming a hotline, going, oh my God, now twins, does this make this worse? Double the hormones? But really the advice was, there's no reason to believe that it's going to cause extra problems. So we just carry on. So I'm now 12 weeks pregnant, and I've had no problems from a lung LAM perspective. And in fact, the first 4 months of my pregnancy, I had no problems at all from a lung perspective. And then the pneumothorax arrived. So it was July 2011. I had a bad cold followed by quite a hacking cough, which I was quite worried about. And we went on holiday to Devon, and I was trying not to cough. But during the holiday, I started to feel a bit unwell, and my pneumothorax is always quite subtle, but I kind of had an inkling, and I called Simon on the hotline and said, what do I do? And I think we both agreed that I probably should go for an X-ray, which, as an expectant mother, gives me my first question, which is, X-rays and babies, you're not supposed to have X-rays if you're pregnant, blah. And that's where I met the first of my lead aprons, which basically protect the baby from the X-rays and stuff. So I went for an X-ray, and the guy at the A&E doctor came back and said, there's nothing there. And he actually said, you women worry too much. So I went away kind of going, I don't quite feel right. And a week later, I went to my local hospital back in Chichester. They confirmed there was a pneumothorax, this time at the bottom of my lung. So pre-pleurodesis, it had always been the top of my lung that had gone down. This time it was the bottom. And in fact, they looked at the Western-super-Mare X-ray and said there had been a very small pneumothorax when I was in Devon, so I had been right. There you go. Back to the deep joy of a lung drain, being put in. Lung drains are my nemesis. For me, they normally involve copious amounts of morphine, which gives me my second question as an expectant mother. Like, I obviously can't take pain-killing drugs while I'm pregnant, can I? And what was really interesting through the pregnancy was that both my thoracic doctors and my obstetricians both said actually morphine and opiates aren't a problem at all for children. The worst thing that could happen is the child could come out slightly dependent, and then we would just get them off the drug, basically. But actually they aren't known to cause any difficulty or any damage to children. So kind of feeling, and it still feels counterintuitive now, but I had a morphine drip for my chest drain, and off we went. So the next problem we had was that the lung wouldn't stay up. So every time we pulled the drain out, the lung collapsed again. And so we then, my normal surgeon was on holiday and had another fab surgeon at the Brompton, and we decided to do a pleurodesis. So third question is an expectant mother, because I need to be put to sleep for this. So general anaesthetics and babies, well, my God, what happens? But the advice was really the risks are the same as for any other general anaesthetic, and the babies would just go to sleep with you. So I was literally scrubbed, bathed and ready for surgery when my normal surgeon returned from holiday, swept in and said, this is a precious pregnancy, we're going to manage it conservatively. And I thought, well, what does that mean? So we didn't do the pleurodesis, no general anaesthetic, but I was still there in the middle of pregnancy with a collapsed lung and 2 babies requiring oxygen from me. So what do we do? I guess we knew that LAM was having an effect and causing the pneumothorax, but we just didn't know. I don't still to this day really know why. After a week with the lung drain bucket at my side, walking around the Brompton, I started to think I was going to kind of move in for the rest of my pregnancy. When my surgeon appeared with a little device called a pneumostat. Has anybody seen a pneumostat? Hands up if you have. God, no, okay. I hadn't either. It's a strange little thing, but basically what it does, it allows you to keep a chest drain in and go home without the bucket. Now, I was kind of rather attached my bucket at this point, but I've even got photos of me with a bucket. But basically, it's a one-way valve, so that's where the chest drain comes out, on your side or wherever, and it basically attaches to the end of the chest drain and allows air to come out but not go back in, so it basically keeps air coming out from the lung. And you test it by just popping some saline into a little air leak well, and if bubbles come up, there's air coming out and it's working. And it was attached to me by 1 stitch and a boatload of surgical tape. I wish I'd bought shares. Effectively, I was able to go home from hospital the next day as a free woman, or so I thought. And obviously, it did have some advantages, having a pneumostat, because it meant I was able to go home and be pregnant at home rather than in the Royal Brompton. But there was quite a lot of practical disadvantages, and I think overall, when I look back to my pregnancy, it was all practical disadvantages. So, number one, I couldn't bath, I had to have a shower. Or when you're pregnant with twins, you really just want to sit in a hot bath. I couldn't sleep on my right side, obviously, because I had a tube in my lung. And actually, from a pregnancy point of view, you're also advised not to sleep on your right. So that was kind of cool. So I needed about 7 pillows to feel comfortable in my chest and had to sleep on my back or on my left side. And my then partner had to become my live-in nurse because it needed loads of maintenance to keep it going and working. So often it would pull down on my skin, he'd need to strap it up, it would fill with fluid, so he'd have to sort of syringe the fluid off, which felt really weird in my lung. Sometimes the pneumostat would get a bit full of gunk, so we'd have to clamp off and replace the pneumostat. I think he quite enjoyed all the surgical gloves and things. And our spare room literally started to look like a hospital store cupboard. It was full of all sorts of stuff. But the biggest hassle of all is that the drain would block with gunk, and that's obviously a medical term. The medication that could stop me producing this gunk in my tube, in my lung, I couldn't take because I was pregnant. So I reckon every 4 weeks on average for the final 5 months of my pregnancy, I'd kind of feel my breathing wasn't brilliant. We'd put the saline in the little air leak well, no bubbles. So we'd first tried to flush it with saline, which was another technical procedure for my now husband. And sometimes that cleared it, sometimes it didn't. But within 2 days, we were normally back at the Brompton having the whole chest drain removed and put in again under local anaesthetic. Deep joy, more morphine. So it went on like this, lots of trips to London from Chichester. The only good news about the repeat lung drains is that they got a lot less painful. So by the time the end of the pregnancy came, I needed a replacement drain. I had it done in 10 seconds with no anaesthetic because I had a channel of scar tissue, so the tube just went in and out. So that was quite nice, if you can call it that. Anyway, so it was a pregnancy of real ups and downs. At the 20-week scan, we had the great news we've been hoping for, which we had a boy and a girl. And we were like, oh my God, that's brilliant. We've got like a ready-made family in one go. If we're only going to do this once, that's brilliant. And then I stopped feeling movement on one side and had my suspicions that 24-week scan, we were told that the little girl's heart had stopped beating. So it was really sad, and I think it's really important to stress here that, as far as we know, LAM had nothing to do with the miscarriage of our first twin. It's just one of those things that is unfortunately quite common in twin pregnancies and just really sad, but that was a really difficult thing to get over. And I kind of went from enjoying my pregnancy and swanning around as the mother of twins to just going, I want the little boy out safe. I just want to get to the end of this pregnancy now. But on the good news side of things, me and Alex got married. It was a bit of a shotgun wedding, and down in St Mawes in Cornwall in September. So yeah, it was quite a hectic few months. So in terms of the obstetric side of things, it was at this point my surgeon, my obstetrician in Chichester looked at me with my lung drain on the side and kind of looked like she didn't really want to sort of have anything to do with me. So we agreed with her that I would go and be seen by the Chelsea and Westminster Hospital because they have lots of experience of dealing with people with women, pregnant women with medical issues. So I felt more comfortable, and also it was 5 minutes around the corner from the Brompton should anything go wrong, because we didn't know what was going to happen in delivery. So that involved even more trips to London, up and down from Chichester. At a time when it was becoming winter, I was sitting on trains with people coughing all around me, and I was just going, please, I don't need to get any germs at all, and luckily I didn't, so that was great. I pushed for having a caesarean. Interestingly, the advice from both my obstetrician in Chichester and in London was, you could have a normal birth. We would just give you a massive epidural, and then you wouldn't have to really puff and pant and push, and the baby would just be delivered by forceps. And I kind of thought, I don't really want that. I want a caesarean. And I thought, if there's any advantages of having LAM and having this tube in, it's that I can get a caesarean if I want one. So that's kind of the line that I played. So Harry was due on the 23rd of December. So what we decided to do was have the elected caesarean on the 8th of December, so that there was no chance I'd go into premature labour. And I even went into the hospital a week before that, just so that there was no chance that I'd go into labour in Chichester and be nowhere near the Chelsea and Westminster. So the final issue we had to overcome was that Harry decided to be breech with his head stuck up into my lungs somewhere. So by the time about the 5th of December came, I was lying in bed, sort of panting a bit, and the doctor just looked at me and said, do you want to have him sooner? And I was like, yeah, please, can we just get on with it? So we had Harry on the 6th of December, and it all went really smoothly. If I did it again now, I would just have it done at my local hospital, to be honest. But this is me looking glamorous, clutching a pillow, about to have my epidural. Weirdest thing in the world ever is walking and sitting on your own operating table. And then that's just after having had Harry. That's just after he was delivered as well. So yeah, all went really smoothly. And they monitored him for morphine withdrawal afterwards, but there were no issues at all. And I went home 4 days later with my husband, Harry, my lung drain, of course, my pneumostat. And I walked up the stairs carrying bags after my caesarean, no problems at all whatsoever. So that all went really smoothly. So we still had the issue of the pneumothorax. And me and my surgeon, my thoracic surgeon, had basically planned that a month after the birth, once I got used to breastfeeding and stuff, I would go in and had my pleurodesis. Well, what actually happened, in fact, was something different to that, because about a week after I'd had Harry, I was at home, and we tested the drain, and there was no bubbles coming out. And I was like, oh, God, we've got to go to London. We've got a 1-week-old baby. So we all pile in the car, me, Mum, Harry, go to the Brompton, have an X-ray, no lead apron this time, and surgeon comes back and says, lungs up. And it took me a while to compute what that meant. And so there's no bubbles, there's no air coming out, and the lungs are, oh. And he said, well, we were hoping the lung would fix itself at some point. And that was it. He said, come back in a week, we'll do another X-ray. If it's still up, we'll take the drain out. And so that's exactly what happened. So a week later, having lived with a chest drain for 5 months, my surgeon whipped it out and put it in the bin next to me, and I kind of felt like a part of me's been ripped off. But that was it. That was the end of the whole thing, and my lungs stayed up ever since. I've had absolutely no problems whatsoever. So that's my pregnancy story. This is Harry and me last week. He's 2.5. Was it worth it? Totally yes. Am I going to have any more? No. But again, not really a LAM thing for me and Alex. Just we don't really want more than one child, and we're quite happy. If I did want loads of kids, would I do it again? Yeah. With the caveat that getting up to the Brompton that many times with a toddler to think about would just be that bit harder. But it's all practical problems, really. So there we go. Final shot. So I'm happy to answer any questions at all afterwards. Okay.
That was marvellous, Kate. Thank you very much. It's yes, that's a remarkably positive story, really. But I think it highlights a lot of the things that we sort of think about when we're talking about these issues to women with LAM. So the next person is Sarah Maloney. Many of you probably remember Sarah. She's been to this meeting. She used to live in England. She's Italian. She's back at home in Italy now. And I asked Sarah to talk. If you're watching on the internet, Sarah, hello. Thank you very much. She has she sent an electronic file, so we're going to hear about Sarah's pregnancy, and you'll hear that it's there are different issues from Kate's and some similarities.
My name is Sarah Melloni. I'm from Italy, and I'm 37 years old. I was diagnosed with LAM in 2007 when I was living in the UK after a pneumothorax and a subsequent CT scan. However, I probably already had the disease for some years, because in 2000 I was actually operated for an angiomyolipoma at my right kidney. Between 2007 and 2011, I was quite stable with the disease in terms of lung function, but I had a lot of pneumothorax, especially to the right lung, and I decided together with the surgeon to have pleurodesis almost every time I had a pneumothorax, in order to limit the potential impact of future pneumothoraxes, and as well as to give me some comfort, especially as I was flying a lot for work and for personal reasons. So from 2007 and 2011, I was, as I said, sort of stable with lung capacity, around 85% FEV1 predicted. And it was about in 2011 when I approached the subject of a potential pregnancies. And I discussed this with Simon Johnson. I talked per email with Joel Moss, and obviously I spoke about it also with the Italian doctor that followed LAM patients here in Italy. And then I guess there were, you know, as you probably can imagine, 3 options. There was the natural pregnancy, there was surrogacy, and then there was the consideration about adoption. And the reason why I went for the natural pregnancies is probably because, to be honest, it sounded to be like the easiest route, the more natural, but also the easiest. And more specifically, I think, in terms of adoption, to be honest, I didn't think that me and my partner were mature enough to go through what you have to go through to be accepted onto the program, and also to deal with potential situation. Plus, my boyfriend and myself at the time, we were living in 2 different countries. So I thought that could also have been even more complicated. Surrogacy, I read about it. I even contacted a few agencies in the US because that was the only country personally that I sort of, after reading about it, trusted. But the reason why I wasn't so sure in progressing with this was because actually in Italy is considered to be illegal. So I could have done it out of the UK, traveling to the US, but then again with passport and things like this, I was a little bit fearful of getting myself into a difficult situation because it's against the law in Italy. And then, yeah, I mean, my lung function was stable, and in discussing with the doctor, they didn't advise it, but they didn't say that I really could not try. You know, it was up to me to decide. And then I have to say I was lucky because within a few months, in April 2011, I got pregnant. Pregnancy was absolutely fine. I was very lucky that I had no pneumothorax. It was a very regular pregnancy. Everything happened in the UK, and I felt very well supported by the hospital and treated. Yes, I was like in a special group, so I had probably more checkups and more control than the usual. But I worked all the way until the 9 months, and I even had lung function tests done when I was 8 and 9 months pregnant, because they basically wanted to check, 7 and 8 months pregnant, because they wanted to check if the lung function had declined, and it had, but it was judged to be normal, the decline, due to the fact that obviously the fetus was growing and it was pressing onto the diaphragm, and therefore it was, allowing me not to breathe as well as before. Delivery, again, it was super normal. It was a natural birth. I had some painkillers given, but I was able to do the normal thing. And again, no complication, no pneumothorax, no particular problems in breathing. And my daughter was born like every other child, I have to say. Then, without really thinking about it too much, then I started to breastfeed. And I breastfed her for the first 9 months because I thought it was a natural thing. It came easy to me and it worked and so on. So this is like, what happened after her birth. Then what happened over the last 2 years, my daughter now is just a little bit over 2 years, I have to say my lung function has actually declined. And in fact, it is now around 60% FEV1 predicted. So it has declined from what it was like 85 before Lily's birth to around 60% now. And now it's been a year that I am on rapamycin. So I would say, what are my 3 considerations on the matter? First of all, it's obviously a super personal decision, both as to whether to have children or not, which way to have them. And I guess doctors are knowledgeable enough to say whether it should not be considered a natural birth, or whether, again, it's up to the individual to decide. And I'm happy with the decision that I taken, and I think it was the right for me. But there can be serious consequences, as it happened with me. Second, I guess my mistake was that for the first full year of Lily's life, I never done any test. I never went back to the hospital. I didn't check my lungs. I was so concentrated on the new job, on the new experiences of being a mom, that I completely forgot about myself. And then I think that was a mistake. Nothing probably would have changed, but again, I was breastfeeding, hoping that was a good idea. I didn't check my lung function, and therefore when I checked it, when she was over a year, it had gone to 60. And then the third consideration is that obviously now I have 1 child, because it's not possible now, to be honest, now the answer that what doctors are telling me is that it's not advisable to try a second pregnancy. So then again, the same reason that I had before for not going down the route of adoption or surrogacy, to be fair, they still hold. So that's the other thing to consider, right? It has gone the way it's gone, but now I cannot have further children. However, then, if one were to ask me, would you do it again, knowing everything that happened? Of course, the answer would be yes. So this is my story. If anyone wants to contact me for any questions, Jane, Kelly, everybody have my email address, and I'm obviously more than happy to speak to any one of you on the phone for any questions. Bye.
Right, so the next person's Sarah Sharples. For lots of different reasons, pregnancy may not be right for everybody, whether they have LAM or not. And of course, for people wishing to have a family, adoption is an important thing to consider. So Sarah's very kindly going to share her experience of adoption with us. Sarah.
Hello? Does that? Yeah. Right, you have to bear with me because until about 2 hours ago I didn't know I was doing this, so I'm not very organised. So I'll give you a bit of background because people have said how they made their decision. As well as LAM, I was born with my bladder on the outside of my body, a couple of things with my kidneys, and I have 2 wounds. So for me to consider a baby to start off with was slightly complicated. And the doctors had just always said, give it a shot, see what happens. Me and my husband gave it a shot for a couple of years. He did a bit of fertility treatment, and we had an appointment. We were going to start IVF. Just as we were about to make that decision, I got sick with my kidney. A couple of months later, my kidney had been taken out, and I was en route to Nottingham to be diagnosed with LAM. So that was just, it was almost like the final straw of saying, there's enough going on in your body. Just kind of leave it be, which for us was fine because from the age of 16, 17, the doctors had always told me that I might not carry a baby full term if I did get pregnant. That there was talk of various things, and so we just thought, we've been through enough now, we'll have a family a different way, and that was absolutely fine. So I was officially diagnosed with LAM in May 2011, and we rang our local council to apply to adopt in June 2011. They start off with, you have a meeting with the social workers, they just have a bit of a chat and see who you are and see if they can work with you. And if they can, you get invited onto an adoption course, which is 3 days, and it's really intense and it's really, really useful because children don't come into adoption like they did in the 50s, 60s and 70s. You don't get young mums giving up the babies just because they can't look after them. Children come into adoption for various reasons, and the majority aren't good reasons for the children. So you've got to be aware that when you're adopting a child, they don't get the starting life that a child gets if you give birth to them and you love them from the start and they're fed and looked after. So the preparation course is invaluable at explaining how to parent a child that's been adopted, because you might pick up parenting at 12 months, 2 years, 3 years, and you've got to form an attachment that people are used to forming with a baby, and that baby might never have been shown attachment. So the course goes through various things like that, and just to make sure you're prepared. Following that, there's a home assessment period where the social workers come to see you every week or so, and they look at everything in your life, your childhood, what your experiences are, what you want to pass on to a child, what your family makeup is, what your support network is, who's going to be involved in this child's life. And it is intense, and I know some people get put off, but it should be intense. Someone's going to give you a child, and you're going to bring up that child until they're an adult. So yes, they've got to look into you. They've got to make sure that you're capable of doing it. When you've done all that, and the social workers have a book on you that's, I swear, about this thick, you go to an approval panel, and sort of 15, 16 people sit and decide your fate of whether you're worthy and capable of raising a child. And one of the members of the panel is a medical advisor. So as part of the report on me, I had a medical at the doctor's, Simon wrote a letter, and another lady on LAM line sent me a note to basically say there is a precedent to adopt when you've got LAM. You can tell them other people have done it. And I was petrified when we went to approval panel that they would quiz me on LAM and that they would be really bothered. And they weren't, because they said they had this letter that said, I'm currently fit and healthy. We don't know when I might not be or if I might not be, and therefore I'm absolutely fine. And we got approved with unanimously. And then it's just a case of going home and sitting and waiting for the phone call that tells you that the right baby is out there for you. That took 3 months later, and got a phone call one morning, and they said there's a 12-month-old little redhead baby that wants a home, and we think that you're perfect for her. So we obviously instantly said yes. We read an entire report on her birth parents, her childhood, what had been on. And then 2 months later, we went to meet her. And, you know, it was a very bizarre situation, turning up to meet your child who's living with somebody else. But it was, you know, it's absolutely brilliant. She'd been with a foster carer since she was 2 days old, so they were incredibly attached to her. But you spend a week pretty much living with each other, handing over the baby so that she gets to know you and you get to know her and you know exactly what's going to go on. At the end of that week, you go and you pick up your baby and you bring them home. And I have to say, in some ways, that was the hardest thing I did, because I felt I was ripping her away from her foster parents who loved her. And my husband kept telling me off that day because I cried all the way home because they were so devastated to lose her. And I felt really bad on her after that because I was just so upset for them that they lost her and we got her. But we do see them every few weeks still. We've kept them in our lives, so it has worked out quite well. The main thing with adoption is after that, the first thing you want to do is you want your family around. You want everyone to come and see you and you want to introduce this new baby. And you can't really do that because it's not fair on the baby. They've got to learn that you are mum and dad, that you are now their primary carer. You've got to give them time to get to know you, to form these attachments. You've got to kind of keep quite a low-key life for a while. You've got to make sure you do all the nappies, all the feeding, because you've got to reinforce that you're your parent, which is a bit hard because if you've got grandparents that have been waiting for sort of 3 or 4 years, they're desperate to come and give a bottle and change a nappy. But that short period of time sets you up for an easy life, a good life. If you don't do that, you might not know for a few years that your attachments haven't quite formed, and it's a lot harder then to drop back a few steps. And yes, you do still see the social workers. They pop round every week just to say hello and make sure you're all right, but it's only for about 12 weeks. And then they just come once a month until the legal process is done. So it took us 7 months from our little girl coming home until she officially got a new birth certificate when her surname was the same name as us. And then that was it. We instantly got her christened, we got her a passport, and that's it. We went on holiday. So as a bit of an idea, we first ever rang the social workers, pretty much making that consideration to adopt in May 2011. And our little girl came home in October 2012. Which is 17 months from start to finish of getting a child. There's people with pregnancies that have a longer process than that. So it's not the arduous years and years and years that people think it's going to be. It was relatively straightforward. I just skipped through what I quickly scribbled. I think that was pretty much the summary of what I want to say. It's not arduous. No, it is. People are questioning. You think when you have a baby, people just make the decision, they have a baby, and the next thing, that's it. No one questions them or asks them how they're going to parent. A lot of my friends who just had babies very easily said it's a downside for them because all of a sudden they've got this baby and they've not had a discussion. How are we going to raise them? What are our decisions going to be on this? What are our views on this? Whereas me and Matt had to not only discuss it with each other, but discuss it with a social worker for 4 months. So by the time Caitlin came along, we kind of knew what sort of parents we wanted to be. We knew what we were aiming for. We knew what we both valued. And it was really, really good to have those conversations. So for us, having our little girl was the best thing, that we ever did. She's absolutely brilliant. She's absolutely crazy. We don't know if we'll go again. We might just stick with one because, life's really good now. Prior to that, like we said, it wasn't necessarily the greatest few years in the build-up, and now we can have fun, we can relax, we can go on holiday and, show our little girl the world. And we'd recommend it to anybody as a route. It's not the arduous route you think it's going to be. And the upside, you don't get stretch marks. You don't have to. As I said, I put on about half a stone in the bridging week when we were meeting her because we had a lot of takeaways. A lot easier to lose that weight than it is from being pregnant. So there's a lot of plus points as well.
Thank you so much for that, Sarah. And yes, Sarah spoke at very short notice, and that was remarkable, actually. Thanks very much. We're getting a bit short of time now. The plan really is just to have a bit of a discussion with Sarah and Kate about pregnancy issues and take some questions from the audience. We also have scheduled for the afternoon a general sort of LAM discussion session, and the time is sort of getting on a bit. So I thought we could perhaps merge those things together, just to sort of tie up the pregnancy side of things. I think, in summary, I guess what it's worth, my view about the approach to this from the medical side, and what I tell people is that some women with LAM do have uncomplicated pregnancies, and we've seen that quite a number of times, and often maintain their lung function afterwards. Pregnancy is associated with a high risk of pneumothorax, an increased risk of chylous pleural effusions, probably increased angiomyolipoma bleeding. The effect on lung function in the future may not is open. I'm not really sure what the answer to that is, but it's possible that some people could be adversely affected by a pregnancy. Pregnancy is not probably your dream pregnancy that you would plan in lots of places, but I think we've heard today that everybody usually ends up with a baby, and they do the same thing again afterwards. And so I think it is an individual decision. Clearly, there are some people whose lung function is very impaired, and you think, well, if they had a pneumothorax or it got a little worse, or even just being pregnant, that would be quite an issue for their health. And so I think the people for whom pregnancy is safe are probably those with good lung function, for those with no angiomyolipomas or small, or maybe they've been treated and embolized, so the risk of them bleeding is slight. And people who aren't particularly prone to pneumothorax, or people who've had pleural surgery to fix pneumothorax. I usually feel safer about saying, it'd probably be okay to go for it, providing you understand the risks in those situations.